Well, the CDC released a study showing how rates of depression and anxiety grew during the COVID-19 pandemic. Nationwide, the severity of anxiety grew by 13% from August to December, with 18 to 29-year-olds getting hit the hardest. UNC Chapel Hill canceled classes this week amid 2 suicide investigations on campus. And the school chancellor was quoted as saying, "We are in the middle of a mental health crisis, both on our campus and across the nation." So a lot of people are wondering, is this the worst? Is it going to get even worse? Mental health, again, has been just a huge topic of discussion by so many medical experts. And now so many more are going to be opening up this discussion for the American people. Let's talk about it with Dr. David Trotter, Chair of Emergency Medicine and at Advocate Illinois Masonic Medical Center. Thank you so much, Dr. Trotter, for being with us. Okay, it's saying somewhere in the tune of 53 million more cases of mental health issues or disorders, just measured in the past year and a half. So really, how big of a deal is this, and what are doctors and the medical community doing to address it?
Well, it's a very big deal, for everyone involved. For the last year and a half, it's just been really hard. And what we've seen, especially in the ER, is a significant increase of patients with anxiety and depression that really just been flooding in. And it's just another long-term effect that we're seeing from COVID, and it's something that we're going to need to treat for years to come.
You and I were talking about this several days ago, and the fact is that you all are starting to meet about the psychiatric effects of this pandemic. We're seeing what's called a second wave, more post-traumatic stress disorder for those who are in the health community, healthcare workers, first responders. Talk about that.
Well, what we've seen is this increase of patients that are new onset anxiety and depression, and they all seem to be exhibiting the same type of post-traumatic stress syndrome that you get from COVID-19. And you're seeing a significant amount of COVID-19 long haulers that are having the same types of symptoms. Typically, they'd have anxiety, depression, as well as some substance abuse. And you need to be able to treat the physical aspects of their ailments as well as the mental health. And it's just another significant barrier that exists with this infection, and just another significant way that doctors are going to need to treat this in a more synergistic fashion.
But what is being done? Are there any policies being created? Is there a new strategy where healthcare workers are being more equipped to deal with the psychological aspects as they deal with the actual health and wellness of the physical body?
Well, there is a multidisciplinary approach to these patients now. Specifically, there are COVID-19 long hauler clinics that are predominantly centered on treating both the physical as well as the mental health of these patients that are suffering these symptoms. And it's really a combination of psychiatry, internal medicine, family medicine, and all the disciplinaries that come together to kind of treat these patients simultaneously, because you can't just treat one without treating the other.
Absolutely not. While I have you here, just one more quick question. The FDA found that a booster shot of the Moderna vaccine enhanced virus-fighting antibodies in people who'd received the standard 2-dose regimen at least 6 months earlier. So do you think that this is going to help with other companies like Johnson & Johnson seeing the same types of success?
Well, I really do think that's going to be the case. There have been studies that have shown a robust response to both the booster from Moderna as well as Johnson & Johnson. So I'm very optimistic that as this goes to the FDA and their methodical approach to approving these boosters, that we'll see these boosters coming out in the near future.
It's too bad that boosters don't give you this good mood juice where you just feel so much better about yourself and get rid of anxiety. And when they create a pill for that keeps you in a good attitude and good mood,
I'll be all for it.
Yeah, we're all for it. We're
Yes,
all for it. Yes, we need to keep our mental health as a focus. Thank you so much, Dr. Trotter. Appreciate you being with us. Well,